We are Team 8, and for our project, we created an alternative procedure for ACL reconstructive surgery. First, start with some background. Each year, there are more than 100,000 ACL reconstructive surgeries done in the US alone, so this procedure is extremely common. The most common surgical option is doing an autograft where the patient's own patellar tendon, hamstring, or quadricep is used, or an allograft where the patient receives a graft from a donor's patellar tendon, hamstring, or Achilles. The autograft procedure requires a second surgical site that leads to increased surgical time, donor site morbidity, and altered site biomechanics, as well as causing an increased physical therapy regimen to be necessary and a higher prevalence of re-injury. Using an allograft eliminates the concerns associated with the second surgical site, but has an increased risk of infection and tissue rejection since the tissue is from a cadaver. On top of the physical problems caused by the traditional ACL surgery, there's also a large financial burden placed on the patients, with the overall cost being over $9,000. To combat the negative effects of the current gold standard ACL surgery, we focused on functionally regenerating the ACL with the main engineering goal of supporting all regular knee functions. Our design will help ACL tear patients, especially younger athletes, to have a much improved recovery.
To address the clinical and engineering needs, we have developed a novel ACL scaffold using research techniques combined into one continuous process. First, we intend to obtain porcine ACL or pig ACL from the stifle joint of the hind legs, and this decision is driven by the anatomical similarities between human and pig ACL, as shown in the diagram, as well as the biomechanical property similarities, such as similar ranges of mean ultimate stress. The obtained porcine ACL would then be decellularized using detergents like Triton X and SDS, as well as a spinner flask bioreactor, as shown in the diagram. These solutions will be used because they effectively remove pig cells without affecting the collagen or ECM structure, which we want to maintain. And we expect this to take between a few days to a few weeks so that the patient can be prepared for their implantation. The decellularized scaffold would then be seeded with human dermal fibroblasts obtained from the patient themselves through a small skin biopsy. And we would use the same bioreactor system as earlier to do this recellularization. Finally, the prepared scaffold would be implanted into the patient's affected knee using a suture repair technique, where our scaffold would be attached to the torn ends of the ACL, and these sutures would be fixated using small bony tunnels. This method has been used in clinical trials for other research studies and has been used in humans as well.
Moving on to benefits and costs. First of all, there will be no donor site morbidity, as there will be no second surgical site for an autograft. Additionally, there will be no concerns for tissue rejection, as we are decellularizing the porcine ACL before we are implanting it. Thirdly, because we are using biodegradable sutures and avoiding the use of screws, the bone tunnels will be much smaller, which allows for less painful and easier recovery for the patient. Furthermore, by using a decellularized ACL as our scaffold, we will achieve similar structural and mechanical properties to that of native tissue, and the seeded fibroblasts on our scaffold will induce growth and promote healing at the wound site. Lastly, our solution will be less expensive than the regular reconstructive surgery. The average allograft surgery costs just over $5,000, while the fabrication of our scaffold can be performed at an estimated $2,200, and it can also be performed outside the operating room. Also, the surgery itself will be shorter due to there only being one procedure and one surgical site, which saves time and therefore saves money.
So the main competition to our method would be the ACL reconstructive surgery, but we previously mentioned the many issues that come with this. Our method would have a better healing time, specifically for the autograft, since there isn't a secondary surgical site. It would also be less expensive to use a porcine ligament than it would be to get a tendon from a cadaver as used in allograft. Another competitor would be the collagen scaffolds, which is another tissue engineering solution. So CellGrow is a specific product that has been used in surgery with positive results in terms of wound healing. This method has had a lot of issues with osteointegration, so it's often just stabilized through similar drill holes made for the reconstructive surgery, as shown by the image on the top right. So our method reduces the size of these bony tunnels and reducing the issues associated with healing in the bone. Thank you for your time, and feel free to leave any questions or comments.